So, what is the relationship between sleep and cardiovascular health?
So we have this syndrome called obstructive sleep apnea, which a
Yeah.
lot of people will be suffering from, especially obese people, people who are big, who have their BMIs above 40. And so sleep disturbances can cause a lot of heart problems. It can cause more plaque buildup in your arteries. It can accelerate this process of heart attack. It can also cause some rhythm disturbances, in fact. And one of the more common rhythm disturbances, which is called atrial fibrillation, which is an irregular rhythm of the heart, which predisposes people to stroke, that is also triggered by sleep apnea too, one of the risk factors. So sleep is very important. Sleep, relaxation are very important for prevention of all kinds of heart disease.
Some sort of heart disease. Hence, it is very important to know more about these heart diseases and basically on heart health overall. Joining us today, we have Dr. Kiran Mangalapalli to discuss a very important topic of heart health. Dr. Kiran Mangalapalli, welcome to Doc Talk Live, and thank you very much for volunteering your time to be part of this show. Please tell our listeners a little bit about yourself.
Sure. Thank you, Dr. Makadia, for the kind introduction. So, I am a board certified cardiologist specializing in interventional cardiology. Our practice is at Prime Heart and Vascular. We have three locations in Allen, Frisco, and Carrollton. And I practice with my partner, Dr. Rishin Shah.
Excellent. Thank you so much, Dr. Mangalpally. So let's get right to it. So please tell our listeners, what is heart disease? What does it comprise of?
So, heart disease has several characteristics. There are several diseases. One of them, the most common, is heart attacks or coronary artery disease. And then there are diseases of the rhythms of the heart, the electrical circuit. And one most common thing is atrial fibrillation. And thirdly, we also have disease of the valves like aortic stenosis, which is the main valve which pumps blood from the heart to the rest of the body. If that gets tightened, it's called aortic stenosis. So there are different aspects of heart disease, but I think what people are mostly concerned about is blockages in the heart or coronary artery disease or heart attacks.
Excellent. And so tell us, what are the signs and symptoms of these heart diseases that someone should be looking out for at home or wherever they are?
So with heart attacks, the symptoms can be chest pain, shortness of breath. People can sometimes feel their heart racing and they become very sweaty. And with coronary artery disease, with the plaque progression, with blockages in the heart, which can happen more in the 60s, 70s, or 80s, people can just come in with chest pain or difficulty in breathing with activity, and then it gets better with rest. So typically, I just keep hearing that, I was walking up the stairs or I was doing some gardening work in the yard and I had some pain, and once I rested for 5 minutes, it went away. So that's the typical kind of symptoms which tell us that, hey, this patient might be having some blockages in the heart.
Okay. So can you tell us, how are these heart diseases diagnosed?
So first, when you go to a primary care or your cardiologist, they will be taking a good history and then examination, and based on that, we may be able to at least infer to what kind of heart disease you might be having, whether it's a rhythm of your heart, or is it blockages in the heart, or is it your valve condition. And based on that, you first do an EKG, which is an electrocardiogram, which just tells us about your electrical circuit in the heart. And it tells us if you're having a normal rhythm or not. It can also tell us if you're having an acute heart attack. And when you are hospitalized, we also do this blood test called troponins.
Mm-hmm.
And if the EKG does not pick it up, and if it's only on the blood test, then that's a different type of heart attack. And but that's usually done, and when we diagnose it, it's based on these two tests in the hospital. And after that, if this is both of them are negative, don't show anything, then we do something called a stress test. A stress test is a bit different. There are different kinds of stress tests, and your doctor, your physician, or cardiologist can advise you what kind of stress test is best in a particular scenario or in your condition, And a stress test is basically we are just stimulating the heart to go off at a higher heart rate. You may be exercising, or else we may be just giving some medications which dilate your blood vessels of the heart, and then we compare the blood supply before and after the medication. And if the stress test is abnormal, then your doctor may advise your next step in treatment, which may be either just medications or which may lead to an angiogram, which is a more invasive procedure.
So can you tell our listeners a little bit about this angiogram?
So angiogram is an invasive procedure wherein we can go up from the wrist or through the groin, and we basically take a small catheter, put it all the way to your heart, and the patient is usually lying down flat on a table, and there will be an x-ray camera on top of him or her, and then we inject some contrast, and we can see under x-ray when it fills up the blood vessels of the heart. So if there's any blockage, we see that the contrast is not flowing through that or poorly flowing through the blockage, and then we can say, hey, this guy or this woman has got so many blockages, and then depending on the number of blockages, we either advise a stent placement or we advise a bypass surgery, or most of the times just medical therapy. It all depends on the degree of blockages.
Gotcha. So you just mentioned that that's basically one form of treatment. What are other form of treatment of these blockages?
So if people have only mild disease, so if anything less than 70%, we usually try to do it with medical therapy. And when I say medical therapy, we put them on a host of medications. We put them on aspirin and on cholesterol lowering medications, and we control their risk factors. And if you end up with a stent, then we usually also give blood thinners. People must have heard about Brilinta or Plavix or Ticagrelor. So these are some of the blood thinners which we give when people end up with a stent for at least a year, apart from aspirin.
Got it. As far as risk factors that you mentioned, what are certain risk factors that you're talking about when it comes to heart disease?
So there are a few risk factors. I just call it the pentad, or 5 main risk factors. One is diabetes. That's the most important risk factor.
Right.
And then high blood pressure, high cholesterol, and obesity, and sedentary lifestyle. Also, kidney disease can also accelerate the progression of the plaque in these people.
And I'm sure folks want to know, what about smoking?
Smoking is the biggest risk factor. Yeah, diabetes and smoking, I always tell, those are the biggest risk factors for heart disease, for heart attacks.
So folks, smoking is injurious to health.
Yes.
You're listening to Doc Talk Live, and we have Dr. Kiran Mangalapalli from Prime Heart and Vascular discussing heart health. Dr. Mangalapalli, a lot of people would ask the question, is this genetics? Is the heart disease hereditary?
So it runs in families, but then there is a genetic component to it. But you should also realize that this is a lifestyle disease.
Okay.
So when people say that you had a heart attack, that my mom had a heart attack, my dad had a heart attack, I always ask them, at what age did they have it? Usually in males, if it's less than 55, then we say that, there's a risk of heart disease in the family. Or maybe if it's in a woman, if the age is less than 60. But most of the time, what answers I get is, my dad was in the 60s or 70s, he was a smoker, he had high blood pressure, he had diabetes. So in those cases, it may not be that it's running in the family, it's all because your lifestyle, you have to control your blood pressure, you have to control your diabetes. And once you control those, you see that it's no longer there, I always tell all my patients that this is a lifestyle disease, And most important thing is change your diet, start exercising, control your blood pressure, control your diabetes, see your primary care physician. He can adjust your medications for cholesterol, for diabetes, for the blood pressure. And that's the way to go, is to control your risk factors.
Got it. Got it. Excellent. So, what are some of the screening tests that should be done regularly for people who are who has these high risk factors?
So coming to the screening test, we just don't screen routinely. Like, for
Mm-hmm.
gastroenterologists, we just say, do a colonoscopy after so and so age. So it's like we don't have anything per se. We don't want to do an echo or a stress echo unless you're having any symptoms. The
Mm-hmm.
reason being is that, there are a lot of people who can be having heart disease. In fact, heart disease starts off at a very young age. At Not many people know that, but it starts off at the age of 7 to 10. But that's when people will have plaques in their hearts. And most of these studies were actually done after the World War II, after the Vietnam War, in young people who died, and in all these autopsy studies in 18-year-olds, 20-year-olds, they have already seen that they have this plaque deposition. So I always try to tell, this is more like a lifestyle disease, and you should be eating healthy, you should be exercising all the time. And once we do that, then it would be good. So coming to that screening test, that's one reason, because most of them might be having plaques, but is it relevant to you? Are you having any symptoms? Because most of the times we only have symptoms if it's more than 70% or
Mm-hmm.
90% or 95%. And if you are leading a sedentary lifestyle, you may not even be able to recognize it until there is a 95% or a 99% blockage. If you're exercising, then we may know that, okay, you're having only symptoms while exercising, you're not having any symptoms while you're not exercising, maybe you have got about 70% or more blockages. So we don't want to go in and then find out, but if someone is really interested in knowing what is their risk, we have got a couple of things which we do. We have now have the Ascvd score, which
Mm-hmm.
incorporates your age, your risk factors of high blood pressure, diabetes, cholesterol, and it takes all of those into factor. And then there's an algorithm which we can input all of your numbers in there, and then it will give us your 10-year risk for heart disease, your lifetime risk for heart disease. And based on that, we just say, what do we do for prevention? Just put people on an aspirin or a cholesterol pill. And if you want to see if people don't want a cholesterol pill, or if they are too young, or if we have the borderline criteria for starting a cholesterol medication, then we can do something called a coronary artery calcium score, which basically tells us, is there any calcium deposition in the blood vessels of your heart.
Got it. Got it.
Yeah.
Okay. For the folks who are just joining us, you are listening to Doc Talk Live, and we have Dr. Kiran Mangalpally discussing heart health. Dr. Mangalpally, so you mentioned lifestyle. So, what are some of the lifestyle changes people can make to prevent heart disease?
I think the first thing is eat healthy and exercise. That's what I always tell my patients. Eat healthy food, eat a lot of green vegetables, and cut down on red meat. Eat more fruits, eat more vegetables. And I think this should come as a when you're young, because the plaque deposition starts when you're 7 to 10 years old. So it's not something I always try to tell my patients too. It's not something which you should be doing. Your whole family should be doing it.
Mm-hmm.
Your kids should be doing it too. And I try to stress that at home too. I think it's the culture of fast food which we have. And actually, you bring up a good thing about prevention. And then, I went home yesterday, and then my son, he showed me a cookie which they baked in school, and it was about this size, not too big. And then he tells me, we added 3 tablespoons of sugar in it. And then you look at the kids' cafeteria menu. What do they serve in school?
Yeah, French fries,
Yes.
chicken tenders,
Yeah,
mozzarella sticks.
exactly. And then actually, my son and daughter now say that, I don't want to take any box lunch from home. I want to eat in the cafeteria. So I think we should be changing this lifestyle from the very young age. We should be changing
Mm-hmm.
probably the kids' cafeteria menu, and then the teachers in the school should not be teaching them how to bake cookies. We should not have this cookie sale for Girl Scouts and everything. Instead, we should be having, why don't you make some healthy salad? And I think, it's we should just change our culture, I think, because food, it's part of our culture. It's like, eating healthy food should start at home. So I always tell everyone, just change what you're eating and let the whole family adopt your healthy lifestyle. Cut down on the sugars, cut down on all the processed foods. Anything in a packet, anything in a can, is probably not healthy for you. Just make your own vegetables, eat fruits, vegetables, let that have at least 30 to 40% of your diet, of your calories should come from fruits and vegetables.
Absolutely, absolutely. So let's shift a little bit and let's talk about sleep and heart health. So, what is the relationship between sleep and cardiovascular health?
So we have this syndrome called obstructive sleep apnea, which
Yeah.
a lot of people will be suffering from, especially obese people, people who are big, who have their BMIs above 40. And so sleep disturbances can cause a lot of heart problems. It can cause more plaque buildup in your arteries. It can accelerate this process of heart attack. It can also cause some rhythm disturbances, in fact. And one of the more common rhythm disturbances, which is called atrial fibrillation, which is an irregular rhythm of the heart, which predisposes people to stroke, that is also triggered by sleep apnea too, one of the risk factors. So sleep is very important. Sleep, relaxation are very important for prevention of all kinds of heart disease.
So, what about hypertension or high blood pressure? How does that play a role in the heart health?
So high blood pressure can cause thickening of your heart muscle. So I always tell my patients, it's like when you go to the gym, you exercise, you lift weights, and then you develop all these muscles. So for the heart, it's like, if your heart has to pump out against a high blood pressure and everything, your heart will get thickened. But that's not a good thing, having good muscles and everything, that might be healthy, but not having a thick heart muscle, that is bad for you. And because that can cause difficulty in breathing. A lot of patients come in and say, I can't walk uphill now. And one of the more common things is because they might be having a thick heart muscle and their muscle is not relaxing enough to bring blood supply to the heart, and it can cause heart failure. And so high blood pressure can cause heart failure. It can also accelerate the progression of the blockages of the plaques in the heart. It can cause both these heart conditions.
So, speaking of the plaques, can you explain to our listeners how high cholesterol can impact this?
So cholesterol, most of these plaques contain cholesterol, and then oh, we always try to treat patients based on their risk factors. They may be having, if they have, depending on whether they have high blood pressure, diabetes, did they ever have a heart attack in the past? And based on these, we treat the cholesterol numbers. So if you don't have any of these, we might be a little bit more liberal. But if they have any of these, especially if they have a heart attack in the past or if they have a stent, then we really want that bad cholesterol, which is called LDL, that to be as low as possible. Because when we are born, our bad cholesterol is somewhere around 60s, 70s. With all our lifestyle changes and the food which we eat, it might be going up to 100, 120, 130. In some people, it may also go as high as 200. And all these medications which we give, they basically lower the good cholesterol. But we don't have any medications to increase the good cholesterol. So good cholesterol can only be increased by changing your lifestyle, by stopping red meat, eating a lot of fish, eating a lot of nuts, walnuts, hazelnuts, pecans, and exercising. And that will really increase your good cholesterol, and it can try to neutralize your bad cholesterol too.
Great, great. Thank you so much for that. For the folks who are just joining us, you are listening to Doc Talk Live, and we have Dr. Kiran Mangalpally from Prime Heart and Vascular discussing heart health. You talked about some of the symptoms of a heart attack. If someone notices these symptoms in their loved ones, or they actually having these symptoms at home, how should they respond to that in that situation?
I think the first thing is if you're alone at home, call 911. Even if you have a friend or a relative who can drive you, I would still say call 911 and then get an ambulance and then go to the emergency room. The reason being that, if you are really having symptoms of a heart attack like chest pain, shortness of breath, and then the heart racing, and then you're sweating all over, then you never know when you might pass out or when you might go into this irregular heart rhythm. So you don't want to be in a situation wherein you are driving and your heart suddenly stops, or if your loved one is driving and you're in the sitting next to him, they'll be freaked out if you have passed out or anything. So it would be best to call 911 and then they can do an EKG immediately, and then they will know if you're having an acute heart attack, and then they can take you to the hospital. So I always say, if you think it's really symptoms of a heart attack, then call 911.
Excellent. So one of the things you mentioned along the way was atrial fibrillation. So let's shift gears to that a little bit. Can you explain to our listeners what is atrial fibrillation and what are some of the causes of atrial fibrillation?
So atrial fibrillation is an irregular rhythm. The word atria refers to the upper chamber of the heart, and the fibrillation means it's just going too fast, it just fibrillates. So that upper chamber is beating at almost 400 to 600 beats a minute, and not all of those beats are transmitted to the lower chamber. The lower chamber can then beat at about 100 to 180 beats per minute. But when the heart is beating so fast, then there is a stasis of blood, and when that happens, there's a blood clot which can form. And when you go back to normal rhythm, that blood clot can go from the upper chamber to the lower chamber, and then when the lower chamber squeezes to give blood to the rest of the body, guess what's just straight above is your brain, and then you can get a stroke. So this is one rhythm where we really want to treat, mainly at least for the stroke, so we try to put people on blood thinners. Coming to what causes it, there are several causes. We still don't know the exact cause, but then it could be, but it's definitely linked with age. It's almost 25% of the population above 85, and up to 10% of the population above 75 years have this irregular heart rhythm. And there are different modalities to treat it, but irrespective of how you treat it, we always at least want them to be on a blood thinner to prevent a stroke.
Got it. What are some of the signs and symptoms of atrial fibrillation?
So some of them can have chest pain. Some people will feel their heart racing. Some will have difficulty in breathing, and some will just not have any symptoms at all. It may be routinely diagnosed when you get an EKG in your doctor's office, or when you go to the hospital for something else and then they do an EKG and we may just find it. So it just could be asymptomatic, or they could be having all of these symptoms.
Got it. We have about 2 minutes remaining, but so you mentioned briefly about the treatment for atrial fibrillation. Can you expand a little bit more on how do you treat this rhythm?
Yes, so we usually try to control the rate, or else we also have medications to convert you back to normal rhythm. And nowadays we have got electrophysiologists who do these ablation procedures, and we even have several ablation procedures which are very successful. And I would say if they are symptomatic and if they don't respond to treatment with one or two rhythm control agents, then ablation is probably the way to go, and that can help them be cured of their atrial fibrillation. Sometimes it may not work as well, but then when they go in for a second round of ablation, it does help too.
Excellent. Well, we are approaching the end of this episode. We could sit here and talk about heart disease all day, and I'm sure that we have a lot to cover. But folks, we are approaching the end of this episode of the Doc Talk Live. Remember to check out our Facebook, Instagram, Twitter, and of course the website doctalklive.com to obtain more information about this week's shows as well as next week's shows. And remember to also tune into podcasting like Spotify, iHeart, and iTunes. And of course, if you have any questions, send your questions on these topics on any of our social media platform. Dr. Mangalpally, we have about 30 seconds remaining. Any last minute information you would like to share with our listeners?
Sure. I've got two advices: eat healthy and exercise.
Excellent.
That's the
That's
best
short
thing.
and sweet. Yeah.
Yes, just eat healthy and exercise. I always tell my patients, when you come to see me, what will make you better? 40 to 45% is from the food you eat, 40 to 45% is from the exercise. What I do with medications is only 10 to 20%.
Excellent. Folks, you just heard Dr. Kiran Mangapali from Prime Heart and Vascular. And for more information about his practice, you can check out his website, www.primeheartandvascular.com. That's www.primeheartandvascular.com. Again, thank you so much, Dr. Mangapali, for coming on our show. We truly enjoyed this discussion. I'm sure our listeners have done also. So again, this is Dr. Makadia signing off. Stay healthy, America.
Thank you, Dr. Makadia.